Hello. So welcome to homeopathy, what it is and how can it help. In this talk, I really want to help demystify homeopathy a little bit. I'm not entirely sure why, but I get a lot of people who seem to think it's very airy-fairy, it's sort of super out there. It's almost like it's some sort of magic that people think of it as. And to me, it's really, really not. To me, it's very concrete, it's very straightforward. Anybody can do homeopathy. And it's very powerful. So I really hope I can help get that across to you today. So quickly before we get into the meat of things, this talk in no way contains medical or health advice. It is only general information and education. So if I tell you to jump off a bridge, please do not do so without talking to your doctor first. So my name is Brittany Harris. I'm a homeopath in Ontario. I'm a graduate of the Canadian College of Naturopathic Medicine as well as the Canadian College of Homeopathic Medicine. Before then, way back in the day, I studied classical music at Mount Holyoke College in Massachusetts. It's a great college if you don't know it already. I have my alumni mug right here. But I had studied music. I thought I was going to be a musician. I was struggling to get a job after undergrad, shocker, and I ended up just randomly working at a center for low-income kids with disabilities. And I had grown up with alternative medicine, and watching these children go through the conventional model was really just heartbreaking. They were children and they were on 15 different medications, most of them to manage the side effects of the really serious antipsychotics and things that they were on. And their quality of life was just incredibly low. And I don't mean this at all to sound like a criticism of the conventional model, because I think it's very effective and it has a lot of strengths. But the combination of being low income and children with these severe disabilities, they really weren't flourishing in this system. Like their quality of life was really just so low. And it really inspired me to go back to alternative medicine because I felt like there had to be better answers for these children. So I went through my schooling, and after my residencies at both the naturopathic and the Canadian or the homeopathic college, I really felt that although the patients I treated with homeopathy got better faster with fewer side effects, it was a lot cheaper. I think we all know how much supplements cost, and I hated telling patients that really the best supplement was this ridiculously expensive one that you could only find like in this far-off health food store. It's just awful. And I hated that I had to give so many for anyone to feel better, but with homeopathy I could just give one remedy and people would get so much better, and the remedy would be like $5. And honestly, most homeopaths, at least here in Ontario, will include the remedy cost in their appointment cost. So you go to a homeopath, you leave with your remedy, and you don't have any additional costs. You just have the cost of the appointment, and I think we all know that's just not true in a naturopathic setting. Often you have supplements, or you have extra treatments, you have acupuncture, so you have to come back every week. And all of the things that naturopaths do are very effective, I think, but just homeopathy seemed better to me. For everybody. And so when I started private practice, I really only continued with homeopathy. So let's get into the meat of things. So homeopathy, it's really a standalone system of medicine. This means it has its own philosophy, its own way of looking at health and disease, and it's based on very clear principles, which we'll get into a little bit later. But because it's a full system of medicine on its own, I like to compare it to TCM, like Chinese medicine, or Ayurvedic medicine. You can use it for essentially any condition because it is its own full system of medicine. So it doesn't matter if you have a cold or a flu or mastitis or food poisoning, or if you have depression or anxiety or your hearing's a little bad, all of it could potentially be helped by homeopathy. Homeopathy is also probably the most holistic medicine I have ever found. It's one of the reasons I love it just so much. In homeopathy, there is no back pain remedy, for example. There are thousands of back pain remedies. And so a homeopath's job, or your job if you're treating yourself, is to find the remedy that is most similar to your back pain. And so, for example, somebody who comes in who has back pain that's better from warmth and better for moving around is going to get a very different remedy than somebody who cannot move, because that makes their back pain so much worse, and who loves sitting on ice, right? Like those are two very different remedies. And so the intake is very thorough, and in this way we match a remedy to your individual case of disease. It's a relatively popular form of alternative medicine. It used to be, the WHO said it was the third most commonly used form of medicine. It's off the WHO website, and that was back in the early 2000s. So I don't know how it would have changed by now, but in certain countries, especially India, it's incredibly popular. In India, it's a huge part of their medical system. They have these huge homeopathic hospitals. I've never been to see one, but I've heard that, like, if you have an emergency condition, you can go to these hospitals and they'll have surgeons and homeopaths, and they sort of triage, like, what do you need first, and how are they going to work together to help you and things. So it's very, very popular there and used for many, many different conditions. So really what makes homeopathy very unique and different than any other kind of medicine is that it's based upon a law of cure called the law of similars. Sometimes you'll see it written as like cures like. I know it doesn't necessarily make a lot of sense when you just hear it that way, so I'm going to explain a little bit more. Bear with me. But the essential premise is that for example, if you're vomiting, you give something that creates vomiting, which I know sounds absolutely bonkers. So really, please stick with me. We'll get into this more. So this law of healing, the law of similars, has been postulated for thousands of years. Our earliest written record is by Hippocrates in 400 BCE, who said, "Let vomiting be treated by vomiting." It may have been talked about before then, but of course we don't know because we don't have a written record. Between 400 BCE and the 19th century, when homeopathy began as a profession, we have a couple of different accounts of the law of similars in practice. So we have burns being treated with alcohol, warm water, or onions. If you think about it, if you are a whiskey drinker or a vodka drinker, you will know that drinking alcohol, those really high concentration alcohols, will burn your lips a little bit or burn your mouth. And of course we use alcohol as a warming agent. You know, you've been outside in the cold all day, and you maybe add a little something extra to your hot cocoa when you come in because it's warming. So if you have a burn, you treat it with something warming like alcohol, or burning is a better way to put it. Same with warm water. Warm water, of course, in a high dose causes a burn. In a low dose will help heal a burn. Onions and garlic the same, they're both alliums. If you put them on healthy skin, they will burn. And so we put them on burns, and it seems to help them heal. There's this great case in literature actually of one woman. This was before homeopathy began as a profession. This woman had spilled, I think it was like frying oil on herself, the poor dear. And so both arms were covered in burns. She put one arm in cold water because she wanted to, and the doctor convinced her to put the other arm in warm water. So we have a great little self-experiment, right? One arm in cold, one arm in warm. And the arm that had been in warm water healed better with no blistering, whereas the one in cold water had lots of blisters and took weeks to heal. I think the arm in warm water had only taken a couple days to heal. So it really does seem to speed healing, even though this seems completely bonkers. I'm totally with you. It sounds completely bonkers. It seems to work. So in the 1800s, Samuel Hahnemann, who was a physician in Germany, he was incredibly well read. He read all of these accounts, and he was very dissatisfied with how well his patients were getting better at the time, and the conventional model he had at the time. And he started thinking, like, maybe this is a law of cure. These cases above, the burns with alcohol, senna for colic, rhubarb for diarrhea, etc. Maybe these are representing a law of cure. And so he really started to investigate and test it on himself, tested on his poor family. He didn't want to be related to Hahnemann. He was not very nice to his family, I should say. I hear he's very, very nice. And he eventually was convinced that the law of similars always produced better results than using opposites. If you go to the doctor now, remember, it's usually opposites. If you have inflammation, you get an anti-inflammatory. In homeopathy, you would get a pro-inflammatory. So it's really diametrically opposed in that way. Now, here's a more modern example. I like to look in the modern medical literature because homeopaths are biased. I am biased. I only want to see homeopathy work. And I like to try and check my bias by looking in other sources. Because if the law of similars is truly a law of cure, we should see it in multiple places. We should see it popping up in herbal therapies. We should see it popping up in conventional medicine. And that is actually exactly what we see, which I find so exciting. So in 2013, someone did a study, Tobelem and others, where they burned rats, the poor rats. They gave each rat a couple of different burns. One burn was not treated, I believe. One burn was treated with warm water, and one burn was treated with cold water. So each rat was essentially a control, had 3 experiment arms going on each rat. So what they found was that the rats treated with warm water had lower burn progression, meaning the burn didn't get as bad, and increased skin survival. So not as much blistering, not as much flaking of the skin. The burn didn't get quite as deep over time. Okay, a lot of similars at work. So let's continue the examples of the law of similars today. So here are some things from the more mainstream medical model. Ambien, we all probably know as a sleep aid. You take it and it helps you sleep. They are finding that Ambien in low doses, it's called zolpidem in the medical literature, you can see it there, will in fact wake people up from a coma. And if you think about it, a coma is just like being asleep. And so you have somebody who's already asleep but won't wake up, and you give them a sleep aid and they are waking up. Law of similars at work. Ritalin, when given to a relatively healthy person, will act as a stimulant, right? But if we give it to people who are already stimulated, who have ADHD, who are already hyperactive, they seem to calm down. Law of similars at work. This is called the Ritalin paradox, actually, in the literature. Now, digitalis, I don't have a little blurb on digitalis because it's so old. Digitalis has been used for centuries for heart arrhythmias and for heart failure. Now, if you take digitalis in a high dose, it will cause exactly those things. It'll cause heart failure and it'll cause a heart arrhythmia. Now, digitalis is the name of the plant. The drug, I believe, is called digoxin today. Sulfur in skincare products. Sulfur, when applied to the skin, you can see here as a toxicology report down here, it is corrosive. Burns or irritates the skin. Scarring can result, numbness, prickling, itching, burning sensation and stiffness, blistering, tissue death, and infection. Ignore the infection because that's a secondary effect. But if you think about it, these are actually relatively similar to acne. And sulfur is in a lot of over-the-counter acne products. It's not a perfect match for acne, which is also why you will see if you look up sulfur and for skin, they're like, oh, it seems to work for some people, but not for everybody, because it's not a great match for acne, actually. But it has some similarities, which I think is why they find it sometimes effective.